Hello, and welcome to the Dad Nobody Wants to Listen to You About New York podcast. And this week in episode 7, I want to talk about healthcare in New York. There's a crisis in healthcare when it affects the people who are supposed to receive it, but there's also a crisis amongst the people who provide it. There's a crisis in mental health, there's a crisis in hospitals, there's a crisis in terms of the affordability of the healthcare system and the availability of it. And those who live in New York know how expensive drugs can be and how expensive treatments are, and so there is also a major crisis of cost. But like so many of these crises that I've been talking about in the last 6 episodes, this is again largely self-made by the political establishment. The healthcare crisis is certainly not new. I remember seeing Michael Moore's documentary Sicko 16 years ago in 2007, and he laid bare the crisis in healthcare in the United States of America. It was a scandal at the time, and most people who saw it, certainly in the European continent or outside of the United States of America, could not believe that America could have such a defunct health system where people had to go to Cuba in order to get cheaper drugs and treatment because it was too expensive and unaffordable in the United States of America. People couldn't believe that a man who cut off 2 fingers would only get 1 finger reattached by his insurance provider, so he chose his ring finger because his wife would appreciate it. People were astonished that health companies could refuse to treat someone because of a pre-existing condition totally unrelated to the cancer they had. I remember in this case, it was a girl who had acne cream when she was a teenager, and that counted as a previous condition that she didn't put on her insurance form, and then her insurance company would not give her cancer treatment. Well, here we are in 2023, and from what I can see in my research, very little has changed. Even though the Affordable Health Care Act was instituted in March 2010, colloquially called Obamacare. Mostly people know of Obamacare as something that President Obama did in order to try to make the costs of healthcare more affordable for people, as well as enabling more people who were not insured to be insured in the healthcare system. But like so many of these crises, when you hand over something like that to the politicians, it gets so politicized that basically people will criticize it based on party lines rather than the sense of the argument. There was a really funny Saturday Night Live sketch, I think in about 2010, as the Affordable Health Care Act was coming into force, and the comedian who played Barack Obama was joking about his healthcare plans to another comedian who was playing a Republican politician. And President Obama said, look, you agree with everything I'm doing in my healthcare act. You think that healthcare should be more affordable and that the insurance companies should be screwed down more, don't you? And the Republican senator said, well, yes, absolutely. But what I don't agree is that you get all the glory for doing it. Which is just the shock. It's humor, but that's the shock. Even the Republicans didn't really oppose the whole idea of healthcare. They just didn't want to make Barack Obama look good. So they coined the phrase Obamacare as an insult almost, and that's what really stuck in people's minds. People who were Republican generally felt that there was something awful about it because it was connected to a Democratic president. And the Democrats who heard about it suddenly started to believe what they heard in the media, that it must mean that you're going to give affordable care to people who are just layabouts who should be out there working rather than getting free health care. Something, of course, the Americans hate. They don't like the idea of somebody getting something for nothing while they're having to work really hard to afford it themselves. And of course, Saturday Night Live lampooned that very, very successfully by, again, having Obama, played by Jay Farrow, apologizing to the American people that his Affordable Health Care Act was so complicated, and that's the reason that nobody really wants to understand it, because he didn't explain it very well. And he brings on a lot of these fake characters to try to explain why they like his idea. And he brings along this guy with his feckless son, who you could clearly see was was the sort of person that was going to misuse the whole concept of free healthcare. And they made a complete fool of the whole act by making the American people believe in that skit that all that was going to happen was you were going to give free healthcare to people so they could basically call in sick all the time and never have to work. But I wanted to find out where we are in terms of New York in 2023. And at the moment, the annual healthcare cost for employees and retirees of New York City is over $6.3 billion. That's 10% of the total budget. Things are so bad in New York that Gustavo Rivera, the senator for New York, is sponsoring what's going to be called the New York Health Act. This has gone through very, very early stages of legislative approval, but the idea is that it's going to improve on the Affordable Health Care Act, which the Republicans have been wanting to repeal since it was enacted in 2010. Haven't succeeded, of course, because they even accept that you have to have an Affordable Health Care Act. The New York Health Act is going to provide some form of comprehensive health care effectively for every New Yorker. And it's going to require people to keep the bills down in cost because at the moment they're spiraling out of control. The idea of the New York Health Act, if it ever becomes law, is to try to help New Yorkers who have fallen behind in terms of their cost of living, particularly people who can't afford to pay medical bills. Many people don't know that the Affordable Care Act did not include people who were non-American citizens. So people who were coming in as immigrants or as refugees were excluded from this health care. There is obviously also a problem with people who've had medical treatment and are struggling to pay the huge bills. And the Act is going to help that by preventing hospitals from placing liens on patients' homes or garnishing their wages in order to recoup their costs. So, in effect, it would allow all New Yorkers, regardless of their immigration status, to be covered for all the necessary medical services such as primary care, preventative care, specialists, hospital costs, mental health costs, reproductive health care, dental care, vision care, prescription drugs, and all the medical supplies. As I record this podcast, I read that over 100 million adults in the United States are struggling with debt, and more than 195 billion is owed in healthcare costs in the United States of America. It's very easy to find out how expensive things are and how people rack up huge bills if they're sick. I just had a quick look on the internet and I found that the average cost to stay in a hospital in New York is $3,700 a day. And if you have an operation, you get charged for everything down to the tiniest screw. One titanium bone screw is charged at $300. And if you're unlucky enough to need one in your spine, one of those is $900. One of the biggest hospital providers is called the St. Peter's Hospital Group. And if you look at their website, they actually give a sort of a menu for the various procedures that they do. Now, I did cherry pick because I wanted to shock you. But to have a tracheotomy, that's just to have a slit made in your throat so you can breathe, costs $364,444. If you need to be on a ventilator for 96 hours, that's $115,869. And again, if you're unlucky enough to have problems with your heart, to have a cardiac valve procedure will cost you $199,452. Now, even with very good insurance policies, which I'll discuss in a minute, it's still going to cost you a lot of money in extra payments. And I understand that the average person who had COVID had to pay at least $40,000 out of pocket to get treatment. I saw something pretty crazy when I was on a short break up in the Hamptons. I went to East Hampton Beach and I was there with my family. And while I was there, I saw a load of flashing lights and police an ambulance arrive. And of course, we were all quite alarmed, and we went towards there to see what was going on. And it turned out to be a wedding party that was using the beach as a nice backdrop for photographs. And one of the members, an older lady, was obviously having some sort of health emergency. And she was arguing with the police and the ambulance because she refused to get into an ambulance that she didn't call. And I asked around, what's going on? And said, yeah, this happens a lot because you go into an ambulance, it costs you maybe $7,000 to be taken to the hospital, and she doesn't want to pay that. It's a complete crisis for people in New York. It's extremely complicated for people to have health care. The administration for billing and reimbursements is very hard. The average New Yorker is paying 4 times more for pharmaceutical drugs as citizens of other developed countries. And hospitals, doctors and nurses charge more in New York than in any other country in the world, with hospital costs way more and increasing way more and faster than professional salaries for the people who are administering the treatment. In other countries, the prices for drugs and healthcare are usually partially controlled by the government, but in New York, the prices depend completely on market forces. So at the moment, US healthcare and New York healthcare is extremely complex. There's so many rules and different rules concerning the funding or enrollment dates, or what out-of-pocket costs you may have to pay with various forms of health insurance that you have, or whether your insurance is employer-based, or if you have private insurance, or if you're using government-funded plans like Medicaid or Medicare. New Yorkers must decide if they have a plan with high deductible plans, or if they have a fee-for-service system, and they have co-pays and co-insurance. So because New York's healthcare system is a for-profit system, things like hospital care can cost 31% of all the costs of a medical treatment. So because of the complexity of the medical system in New York, medical providers are free to charge, just like in housing, whatever the market will bear. And some of these amounts are just staggering. Unlike many other developed countries in the world, New York and the United States system is extremely complex, and it relies on individuals to have private health care, which is provided by their employers through healthcare exchanges. And some of them obviously manage to get it subsidized by the government. And you wonder to yourself, well, why does the United States not have a universal healthcare system? And there's no really easy answer to that, except that it's always been a big topic for debate in the United States. Some people say that the United States is just too big to have one universal system. So the real bottom line about healthcare in New York and the United States is that, it's not got a system that is very similar to most developed countries in the world. And as such, they have very high costs of administration, which drive up the pricing. In countries around the world that have a universal healthcare system and manage the system, they can negotiate lower costs for drugs and medical equipment and hospital care. And they can also control how patients get treatment. But in the United States, there is a lack of political support, and they don't want the government to be controlling healthcare costs. As a result, prices are being driven up. Unlike a lot of places in the world, there is a tremendous distrust of the government and them getting involved in something like people's private healthcare. So the way people get healthcare is pretty fragmented. But I thought it was quite important to understand the types of health insurance and how people get it. The biggest by far is employer-based health insurance. 49% of people in the United States get their health insurance via their employer. He will charge you a small amount that's deducted from your salary, and the employer will also pay the majority of that to a healthcare provider. In the case of union membership, very often the hotels that I worked in, the hotels paid the unions a large sum of money, and then the unions used this to pay insurance schemes. As far as the employer was concerned, he thinks the union is paying, when in fact, of course, it is the employer. The second type of insurance is called Medicare. 14% of people in New York get it through Medicare. It's a federal health insurance program that's, regardless of how much you earn, is available for people of 65 years and older, and those with disabilities or people who are particularly young. It's a federal plan that determines eligibility, and it gives you a wide range of options and coverage benefits. Then there is Medicaid. 19% of people are on Medicaid. And then this is also a joint New York and federal safety net program. And it provides health care for the most vulnerable individuals, and people have to have certain income limitations in order to qualify. So in New York, in order to be able to get Medicaid, you mustn't be earning more than $1,661 per month. And if you're a couple, you shouldn't be earning more than $2,239 a month. And this is gross. Now, as you can see, in reality, not many people will ever qualify for that type of care, because I think at the moment the average salary in New York is nearly $90,000, which of course is a considerable increase since 2001, when it was just under $50,000. The last type of healthcare is individual health insurance. This represents about 7% of people in New York. These are for people whose employers don't include insurance. Now, you might think that's strange, but it certainly happened to my son when he first moved to New York. They offered him a job, but they didn't offer him health insurance. And this is a very, very difficult area because there are so many different types of insurance plans out there. But that's, again, not the end of the story. There are still 9% of people who are uninsured at all. Now, in all insurance policies, you get things called deductibles. And this is an amount of money that you'll have to pay first before the insurance will pay you anything back. And in most plans, it's usually about $1,000. Then there are things called co-pays. And this is like a flat fee you pay to see a doctor or get some other service, such as a trip to the emergency room. So you may have to pay $20 copay to see your doctor, but say $200 copay if you visit the emergency room. And then there's another type of extra payment. This is called co-insurance. And that's a percentage you pay for some covered services like a trip to a specialist or a certain medical center. And if you have co-insurance, it may be 20% that you pay, and the health insurance will pay 80%. Most insurance policies also have an out-of-pocket maximum amount, which is a good idea because it absolutely caps the amount that you'll ever have to pay within a planned period for services that you get. The Affordable Care Act, loosely called Obamacare, did a lot to try and help people improve the amounts of money that they were having to pay in monthly health insurance. Right now, because of that act in New York, you only have to pay $700 odd for a silver plan, and they're different to silver, gold, and bronze plans. That's still 39% higher than the national average, and making New York probably one of the most expensive states for health insurance. These insurance policies are broken down into various categories such as catastrophic or bronze, silver, gold, platinum. And really, the more you spend for your insurance policy, the more you get. And the less out-of-pocket expenses you have to pay, or the less co-pays you have to pay, and the more services that you can get that will be covered by insurance. So probably the lowest you'd have to pay in New York for health insurance would probably be about $200 to $300 a month, and the most you'd have to pay for health insurance would be about $900 to $1,000 a month. But again, even if you're paying $1,000 a month, you're not going to be fully covered for everything, and you're going to have probably quite a lot of extra charges that are put onto your bill because they're not included in the plan. As I mentioned, those out-of-pocket expenses are capped, and probably in most cases you're going to have a cap of about $6,000 to $7,000 a year. Now, obviously, hospitals and all healthcare elements in New York City are run for profit. But it's interesting to find out, just how much the people who are working within hospitals get paid, and you get to understand really where all this money goes. I looked at New York Presbyterian Hospital as an example. There, the president of the hospital gets paid a base salary of $2.2 million. He got a bonus of $3.8 million, and he comes home with a total of $11.9 million salary. Looking at another hospital, which is the Hudson Valley Hospital in New York, the director of the pharmacy gets paid altogether with his bonuses $291,000 a year. A registered nurse gets paid $237,000 a year. A registered physician in Lourdes Hospital in New York gets paid a base salary of $600,000 plus $193,000 bonus, and he takes home $858,000. Another physician, he took home $1,500,000. And yet, if you look at the New York State Nurses Association, they're all complaining that they're not being paid enough and that there's a tremendous staffing crisis within the hospitals and the healthcare sector generally. They're working very hard to try to increase the salaries more and to get the hospitals to hire more people. Looking at their website, they have a whole section called Profits Before Patients. And they're saying how hospital administrators have created a healthcare empire that is non-profit in name only, but they're really locked into a technological arms race to buy the most expensive equipment, offer the most expensive procedures. They're terribly worried that the insurance companies are making such huge profits and that they're now trying to change the whole system to protect themselves. Because at the moment, it's not allowed in New York State for profit companies to run hospitals. But of course, Wall Street and out-of-state profit healthcare chains are knocking on the door. And even if it's not allowed, it just doesn't seem possible that healthcare could be so expensive if there wasn't a lot of profit that was being made. And indeed, healthcare can be extremely profitable. As mentioned at the beginning of the podcast, Michael Moore in his documentary Sicko discussed the high prices of drugs, and that was many years ago. Things really haven't changed. And there is a crazy system in New York that even if you're in one borough, you can be paying way more for your drugs than if you're in another borough. You can save nearly $2,000 or $3,000 a year just by shopping around within New York City. And some prices of prescription drugs within the boroughs can range from anything from $30 to $80 for a single prescription. So as we're getting to the end of the podcast, I thought it would be quite important to try to make some ideas for solutions to all these issues. And if we're talking about the price of pharmaceutical drugs, it seems immediately obvious that they should be doing something to make all pharmacies charge the same. I think there should be some form of resolution calling on the New York State Board of Pharmacy to implement some new law to prevent pharmacies from charging ridiculous prices. And I think this idea of legislation is not new, but again, nothing's really happening. Earlier, I mentioned the New York State Senator Gustavo Rivera, and he is very, very passionate about trying to do something about the health insurance companies' business model. He's gone as far as saying, I want to destroy health insurance companies' business model. He gives us his reason that he wants to guarantee health care to every single New Yorker, regardless of age, wealth, or immigration status. And he says that this would save a lot of money because the system at the moment is wasting so much money, and a new system would be cheaper to run. Obviously, with the healthcare system in New York being probably the most expensive in the world, this would be a tremendous saving. The idea that health insurance is to be paid by people at these levels has become so locked into people's heads that people think that what he's proposing right now is crazy. But I think there's an incredible amount of support already because the insurance system is still completely out of control. His proposal, perhaps slightly unpopular, would mean that people who are not insured at the moment would get insurance in the future. That would be all the undocumented people, all the migrants. But he's arguing that if you don't give insurance to people, where are they going to go? If they're sick, well, they go to the emergency room. And not only is that more costly in providing them with primary care, it probably provides them with the lowest quality healthcare because it's only really for addressing emergencies. What happens after they leave the hospital? So what he's proposing essentially is that employers, for instance, will pay 80% of the healthcare. Employees will pay a 20% maximum. And all that money will go into a system that will offer healthcare for everyone, completely bypassing insurance companies. So this is the idea, to have a new law called the New York Health Act. And that would be established just for people who live within Manhattan and New York generally. It would provide comprehensive health coverage to all New Yorkers, and every New York resident would be eligible to enroll, regardless of age, income, wealth, employment, or any other status. There would be no restrictions or deductibles or co-pays. Coverage would be publicly funded, and the benefits would include comprehensive outpatient and inpatient medical care, primary and preventative care, all the prescription drugs, laboratory tests, rehabilitation, dental, vision, hearing. All these benefits would be required. As with any other current insurance policy, New Yorkers would also get these services when they're out of state, because obviously when people are traveling, they need to have health insurance. So the whole model would completely change. Instead of right now where the insurance companies are charging based on their premiums and their deductibles and their co-pays, with a new system, the New York Health Act, it would be paid for based on the people's ability to pay. So it would go progressively up according to how much you earn. And as I said, at least 80% would be paid by employers and not more than 20% by employees. So for once, I think it's a nice way to end my podcast by saying that I think in this particular crisis, there is genuinely a solution right out there. And let's hope that the New York State Legislature gets the chance to pass the New York Health Act. By doing so, it'll probably change people's lives for the better. It'll make insurance costs much cheaper. It'll increase the amount of care that they can get. And probably more importantly, it'll mean that every single person is going to be covered instead of the millions who at the moment don't even have health care. How can that be possible in a country as wealthy as the United States and a city that's probably the most wealthy city in the world, that you can't have health insurance? But as usual, it's politics, and there are going to be people out there who are going to say, no, we don't want this system. People should get what they can earn, and nobody should be having to subsidize people who don't earn. And again, rather like that Saturday Night Live sketch, it's very easy to rubbish any progressive plan and make out that it's just going to benefit those who are lazy and can't be bothered to work. Yes, there will always be people who abuse systems, even in Germany, that has an insurance-based system, but also a public system intertwined. There are people who abuse the system. But still, if you need treatment, you can get it immediately here, and you can get very, very good treatment. And nobody falls between the cracks. Everybody gets health insurance. That's the same system in the United Kingdom. Everybody is entitled to free medical care at the point of delivery. Isn't it about time that New York and the United States did the same thing? And not everybody is in favor of the New York Health Act. I mean, many people think that it would immediately demolish the current system and destabilize the current health landscape. It would obviously ban any form of private insurance. Some people say that's wrong because it eliminates options and choice, and that it would force all 20 million New Yorkers into some new, untested, one-size-fits-all state-run health system. That reeks of socialism, and of course many Americans will run a mile before that happens. But it would also probably eliminate 160,000 jobs, and it would probably raise state taxes by nearly 250 million a year. And doctors and hospitals would see their funding cut, and probably there would be people who would lose out at the beginning. But in the end, all of that will be worked out because you're trying to imagine some very complicated system that's been run in a particular way for so long that is now going to be blown up and a new one is built from scratch. Knowing what I do about the way things seem to work in New York, I actually think nobody's going to go down that road. I think it's too controversial, and I think people are just too lazy to change. But what a wonderful idea. It would guarantee the 20 million New Yorkers that they would never have to worry about being able to pay their bills. It would eliminate one of the number one reasons for personal bankruptcy in America. And I think it would just give everyone that sense that they're now enjoying something that's enjoyed in many countries around the world, where medicine is not a commodity, it's a human right.